Hello and welcome to the NASGP podcast and YouTube channel. And today we're recording a live webinar with Dr. Andrew Whiteley from Lexacom to talk about artificial intelligence and its use during the consultation. So, Andrew, thank you for coming along, and I'll hand over to you.
My pleasure. Thanks very much, Richard. It's a pleasure to be here with you. As you said, I'm Andrew Whiteley. I doctor by trade. I trained at Barts, qualified in '93, and then did GP training scheme in Banbury, and was lucky enough to get a job locally. And as a young doctor without family, without any sort of commitments, I had a bit of spare time and realised that there were sort of massive inefficiencies in practice at the time in terms of doing letters, dictations, that type of thing. So just wrote a bit of software to help myself, really, just to try and make my life easier. And then rolled on a couple of years, gave it away to friends and people I knew who thought it was great. Started a company with a friend who just said, let's see what happens. And here we are, 26 years later, with 60% of GPs using our software. Back in before COVID, we were doing well over 50% of all referrals going into secondary care, and 7-8 million sort of letters a day were being a year were being transcribed with it. And what we've done is we've looked at the market and realized a good number of years ago that it was changing and the technology was getting better. So as you say, we've looked at the options available, and we've rebuilt the software from the ground up to try and offer something that will do more than just one thing, more than just AI, more than just digital dictation or speech recognition, and bring it all together to try and have a program that actually works really well for all members of the practice. And whereas I was trying to save myself a couple of minutes per referral and the secretarial team have a much more streamlined, efficient way of processing them, what we're trying to do now is we're trying to give that sort of 2 to 3 minute benefit per consultation. And, early sort of responses we're getting from our customers show that that's happening, and it really is sort of revolutionizing it. And I think, sorry.
Yeah, so you come right at this from the beginning. You've kind of almost been one of those pace setters, I guess, for this kind of co-pilot type technology, and you've seen it evolve and you've adapted as it's gone through. So it shows your credibility as in your experience. So yes, carry on. Sorry,
Well, thank
Andrew.
you. Well, and it's interesting you say that, because I think, I've always liked to think of us as an innovative company. We're the first company that realized it was really important to link that dictation with the clinical notes. So we're the first company that integrated with a clinical system. Then we were the first company to integrate with all the clinical systems in the UK. And we sort of bound that dictation to the notes. So when it comes into the secretary, they click on it opens the notes. And when it goes back to the doctor, they can see which patient it is and it's the right John Smith or whatever. And also, we were the first ones to do a mobile app. We're the first ones to do cloud-based speech recognition back in 2013. And obviously, technology has just leapt ahead. And, what I love about our current version is that it is one product that will allow you to do what you need to do. So, first off, built into it is Lexacom Echo, which really is just a state-of-the-art sort of speech to text system now. So whichever application you want to type into, you just put the cursor on the screen and start talking. And what we do is we say, well, actually, they're looking at Xmas, or they're looking at Word, or they're looking at Outlook. So therefore, this is either going to be a clinical note or a letter or an email. And the difference with Echo is that you basically start recording and you keep talking until you finish. Even if you have to pause and you have to think, you just keep recording. And when you let go, we use, our sort of comprehension engine to look at that and say, well, actually, that's an email. It was going to start with dear and have a new paragraph. And we structure it. So we do all the punctuation, we do everything. We turn out a perfect sort of example of what you wanted to create with very little effort. And that is, just one of the many parts of Lexicon. We also still have the workflow, which still does the traditional digital dictation for those who want to carry on using their secretarial team for their letters and personal work and such. we also have the automated sort of scribe recording. So a doctor would do a dictation as if they were going to dictate it to their secretary, but by the time it arrives at the secretary's screen, it's already been typed, and they're really just there to check it and make sure it's okay. So it obviously saves an awful lot of time. And then there's the other sort of exciting workflows that we're beginning to develop with the clinical integration we have, where we can actually help manage people. So say someone with hypothyroidism, you've made the diagnosis, you've excluded everything of concern, and you're really just going to start them on thyroxine. Instead of having to go through a routine of, um, you know, sort of having to say, we'll come back in 4 weeks for a blood test. We'll check your TSH, T3, T4, then we'll look at your dose and monitor it. We can automate that process and, to inform the patient they need to come for a test, because obviously the latest version we're just about to release has text messaging built in as well. So we can text the patient, we can email the patient directly from in the app. And then, of course, it comes to the part that you started off with, which is the ambient AI, which is really just, taking it to a different level, because now we can have a system where you're sitting in front of that patient, and instead of having to be typing as you're going and thinking about what you're going to record, you can just have a conversation with them. You can keep eye contact with them. You can actually engage with them. And the feedback we've had is, just from the patient point of view, is they just feel more listened to. They feel that the doctor is more present, more interested in what they're saying. Because we're listening to everything, we don't lose any details. So even if it's a long consultation, it gets everything down. And then, of course, because it's structuring it into a structured note or a referral or whatever you want it to do, it's saving that massive amount of time, um, for that clinician, so they can actually just, as they say, take time to spend with the patient, really give them some thought, check what we've actually recorded, and make sure that they're happy with what we've recorded, because we're only going to be a scribe. We're only going to listen and record what was said. We're not going to make things up. But then just categorize it into the sort of SOAP sort of format, and then with the version we're just about to release, it will integrate with System One and with EMIS and with Vision and Medicus coming, and it will just put it straight in the notes with the doctor's consent, saving literally minutes of time. And
So
yeah,
when you're during these consultations, and sorry to interrupt,
yeah,
it's as if the patient comes into a room,
yeah.
you uh, say hello, they sit down. There's a microphone in the room. You tell the
Oh,
patient there's a microphone, and it listens to the whole thing, and it is inputting into the system. Is that what this ambient AI does?
so yeah, so for an example, it's good practice. Obviously, the patient should be informed and they should have consent, because even though our system is completely secure, I think it's if you engage with the patients, then they are much more inclined to appreciate what you're doing rather than being suspicious. And if
Yes.
you're upfront, it's much better. They know, forewarned is forearmed, as it were. And obviously, we have patient packs that people can download from our website to put on the walls in the waiting rooms or on their screens. They can, we've got some images and little movies that people can be explained. This practice uses Lexacom AI, is going to help us create the notes and get more detailed notes for you. It's helping the doctor help you sort of messaging. So yeah, you'd come in, you would say to the patient, I'm going to be using this technology to help me record the notes more accurately, more fully. Is that okay with you? And we're finding that 99% of people say yes. They're welcoming it, because they want, that detail. I think they worry about doctors working so hard and being so stressed and having to sort of remember everything and type it up before they get onto the next patient. I think they see the benefit of anything helping them. But it was very interesting, because while we're saying that, and even though I think the feedback is very positive, there was a YouGov study that we looked into people's perception of technology, and 73% of respondents said they didn't trust big data. They didn't trust the big companies handling that data in a sort of a proper way, which is why we have actually developed what we call patient shield. And what that is anything that goes through our system, whether that be Echo or whether that be the Ambient AI, when it's turned into that text, before it goes to the AI for the Ambient AI, we redact all the information. We have our own processing that does it very carefully. So redacts all names, addresses, pets' names, family names, friends' names, places of work names, anything that could be used to identify that patient is removed and replaced with a token. It's processed through the AI where we say that token's a name, that token's an address. But when it's returned, we repatriate the names in the right place. It comes back so that the user has no idea that anything has been going on, but we're making sure that nothing goes to the AI. And some people say, well, why do that? Why bother? There's a couple of reasons, apart from just, I think it's good practice to make sure that we're not sharing data that shouldn't be going to anywhere else with anyone else at any time. But also, there was a case, I think it's about 2 months ago now, where the New York Times took OpenAI to court and said that they had breached their copyright when they were sucking up all the data for the AI and had used copyright material to train the model. And the court agreed with them. And the judge actually said, and the thing, that OpenAI would have the right to look at all of the inputs and outputs from every OpenAI server in the world to check that it wasn't using any copyright material. And obviously that's been appealed, but for a while, a third-party commercial company had the rights to look at all the data going in and out of every system, around the world and see what was going in. So I think it's a very important step to take. And I think it gives the comfort, it gives the patients the confidence to know that the data has been handled responsibly by us.
And
And
that redaction, does that happen at the doctor's computer level
yeah,
or on your it does on that on
yeah,
the doctor's, it doesn't leave the doctor's room, that
that's right.
information?
The text, sorry, to be 100% accurate, the text is processed on the cloud, but the data before it goes to the AI
Ah,
is
right.
actually redacted on the cloud. So
Yes.
yes, obviously we have a very low footprint on the doctor's computers, because obviously these technologies need massive processing, which is why they need to be in the servers. And while we're talking about servers, obviously, all our servers are in the United Kingdom. They are G Cloud approved servers, which means the government use them for their own departments, their own. I think it's only DCHQ that won't use it. It's any sort of government department will be allowed to use the software, and we keep everything within our own cluster of servers. So even the AI is our own instance of AI. So it's not going off to America or going off anywhere else to be processed. It's all being processed within our discrete bundle of servers in the United Kingdom and never leaves there. And obviously the data is encrypted on the device. So out on the doctor's surgery, every utterance, every word is encrypted so that it can't be read, and it's sent through an encrypted channel so it can't be hacked in transit. And what we do is, when we get to our servers, we ask the provider, Microsoft, to encrypt it again so even we can't read it. So without the user's permission, without the user's credentials which unlock the encryption, not even we can see the data that's on the servers.
Okay, so
Yeah.
there's a lot there about really locking down the security as much
Yeah.
as anyone can. That's great. So that ambient scribe, that qualified medical secretary, who's able to do that for you. So you've got that, but you were also saying as well that these AI technologies can also help with the actual clinical management, create a management plan. So is it as if that invisible AI scribe in your consulting room with you is also a doctor as well?
No, I want to be really clear with that, Richard. At the moment, the AI scribe is just acting as a scribe.
Right.
Those clinical workflows I'm talking about are just non-AI typical programming workflows. So it's where you would say, I want the TSH between X and Y, and it just does the process of saying 3 weeks time, get a blood test organized, look for the result. Is it within those? Pop back to the doctor, tell them what the result is. The doctor's still making things. It's just removing the admin from that process. and
Right.
making it more streamlined. The AI at the moment is very, very clear. We, with the regulations of class one device registration, which we have, means that it is really just reporting what is said by the doctor and writing that down in a clear, structured way to help them take the notes down accurately.
Got you. Got you. Okay. So it's not. It's therefore. Okay. So it's not acting as in a clinical capacity in
Not at
any
all at the
way.
moment.
No.
No, no. With time, obviously,
Mm.
that's going to develop as people get confident with AI and see what its capabilities are. And once providers such as us, prove to the MHRA that it is safe, then with class two registration, we could then start doing more with the data available and with what is actually being said in the consultation. But at the current time, it is purely listening to what is said, making a note of it accurately and clearly, structuring it into the format you like. And the great thing about it, Richard, is you get to the end and you think, well, actually, this is a referral. I didn't realize. So you can do your consultation and say at the end, I'm going to refer you in. And then once you save that in the notes, you just change the drop down thing to referral letter to whoever you need to, click on generate again, and it just generates a perfect referral letter for you. So, that whole process where you have to construct that letter and think about everything to write down is done for you in seconds. And then that can be sent on either to the secretary for processing, or you can process it yourself. Um, Similarly, there's the letters to patients. One of the ones we find when you have that patient that just isn't paying attention or always forgets what happens as soon as they leave the room, and they're a bit forgetful, but you've got quite a complicated plan to go through with them. You can, once you've saved the notes, you can change a letter to the patient, print it off and give them, dear Mrs. Smith, you came to see me today with this problem. What we said together we're going to do is this. And it bullet points it out and makes it very, very clear in plain English. Because obviously, yeah, another thing we do, it keeps on reminding me of the things. We have patient mode in our comprehension engine, which will actually, when complicated medical terms are being used for patients, it will actually describe them in plain English. So, for an easy example, if you say, you're hypertensive, it'll put in brackets, you have high blood pressure, close bracket. So we're using NHS approved simple terms to explain text. And that can be used either live while you're doing it, or if you have a piece of text, in the notes from someone else that you need to share with the patient, you can literally just highlight it and process it, and it will explain it for you, when you print it off for them to take away with them and understand. And we found that anecdotally just reduces anxiety, stops those sort of calls saying, what did you mean when you said this?
Yes.
And those sort of conversations. Yeah.
Okay. So the technology then, the future technology, about supporting the GP in clinical diagnosis.
Mm.
Two questions about what you feel that might bring to the consultation. One is around about what about the existing clinical record, and will that technology, do you think, be able to, when you're talking to a patient, the AI is thinking in the background, oh, well, 3 years ago, this patient had this TSH, and was started on this, and that's not come up in this consultation, so I'm going to bring that in. There's that. But also, that's one question, but also the question about when, if the in this new technology that's not present yet, is that we can use, is will that AI also be able to to pull in, say, the latest nice guidelines or
Oh,
best
well,
practice and that sort of thing? How do you see the future with those sort of technology? Is that going to come? Will that be a threat? Are there other issues with that?
I don't honestly think it's going to be a threat, because I think we are social creatures. We like talking to each other. I'd much rather be in a room talking to you face to face than on the screen. But and when you go to the doctor, not only are you having that sort of personal interaction, you're actually having that trustful reaction. That's why you've got to have that trust with your doctor, because otherwise you won't tell them everything. And I think that, in the situations where that's going on, with time and the nice guidelines and things like that, I think are particularly exciting, because we have a very exciting roadmap that's doing lots of things within the realms of what we're allowed to do and developing further. But one of those is, at the moment, you have a deluge of local guidelines, you have a deluge of national guidelines, you have all these other things, and they may refer to things you don't refer to very often. So it may be hard to recall exactly them. So therefore, you need a quick recourse, system. We could use, AI technology to know all of them. And so you could say, I think this person needs to be referred to neurology, say, or rheumatology for this condition. What are the local guidelines? And it could summarize it quite easily and just give that information instantly rather than you having to trawl through everything. So, yes, I can see things like that happening quite soon.
Good.
Um, Actually helping with diagnoses, it is definitely one of those things. And obviously, looking at historical data in the notes is, you know, a very useful thing to do if it's done safely and securely and all that data is treated, with absolute sort of sanctity as a medical record. But then it could actually be looking for links, looking for, connections, looking for experience, particularly in this day and age where, patient continuity may not be as good in some places
Mm.
as we would all like it to be because of pressures of work. It can actually, you know, at the start of the consultation, summarize the notes. So it just says, actually, this patient's seen 4 doctors in the last year. These are the conditions. They all seem slightly different, so not related. Or actually, there seems to be a pattern. You will display a way which help you decide there's a pattern, and maybe bring information that you might not get out of that sort of 10-minute consultation. So I can see lots of advantages. I personally do not think that doctors' jobs are at risk because every good doctor does so much more than just, listen and
Yeah.
diagnose and talk. It is that holistic care. It is that thinking about other things, knowing the family, knowing how it all fits together. And, I think if you're talking about AI taking that over and being accepted, it's still a fair way off in the future. Yeah.
Something that have over the years of working as GP and locum in lots and
Mm.
lots of different practices is you often come across something in the notes, or as you're going through patient's history, I'm sure we all do this, we realise that there was something that might have been missed or forgotten about, or the
Mm.
patient didn't attend, and actually there were. I'm my I was wanting to ask you is, has it ever, what would happen if we pass AI passive through patients who haven't got any appointments, who are not attending? If we send it to hit the practices
Yeah.
database and say, can you find anything outstanding that we need to call the patients back for? Do we know if that's ever going to be an issue or have any impact?
I, I, I think that could be incredibly useful. I think the GPs of this country hold the vast majority of the medical data about our
Yes.
patients because not only do the GPs see them more frequently and see the natural progression of sort of trivial to moderate to severe sort of chronic diseases as they go through their lives. They also get copies of all the hospital notes as well. So they have probably the most
True.
complete record there is. So yes, that is exactly the sort of thing that technology could do, as long as it's within the set parameters and the set safety standards that are essential to make sure it's doing it properly. And also, what answers do you want to do? I think there's this sort of perception you can just say to AI, "Oh, go and have a look at all this and see what you can find, and hope it comes back with something useful." The reality is, you've got to have models which are trained a certain way to process data in the way you need to
Mm,
return it, and you need to ask the questions in the right way. We've all seen and we've all heard about hallucinations where,
mm,
and that's where the AI will actually gets a little bit excited or a little bit confused and not really know what it's doing. So we'll make up something which is completely believable, but not actually what was said. And obviously, you could look and say, "Wow, that's amazing. It understands that." But the point is, in medico-legal, reasoning, that is not something we want. And it is a fact of all AI at the moment. The large language models that are used all have this risk if the thing you're asking it to do is not properly defined, or if it's getting too big a task and it will start forgetting bits and therefore making stuff up. Um, we have taken a unique approach, and again, we're working on it and testing it, and early results are very exciting. But we have our Lexacom Verify, where the verify ends with an AI, just to be sort of catchy. But that will use non-AI techniques to actually check the veracity of the data returned and make sure that there are no hallucinations. And our early testing is showing is it was reducing them to, literally 1 in 10,000, 1 in 20,000. And so we're doing everything we can to make sure that the data that is returned is accurate and only contains what has been said in that consultation. And I think that's very important that people realise that to be quite blunt, you could literally go to ChatGPT or Claude or Gemini or any of these new AI angels and say, write me a program that does this. And within a couple of minutes, you'll have a system that could do an awful lot of what we do. The problem is it won't do the security. It won't do the, the checking the server side of things. It won't do all the sort of bells and whistles and make sure that it's done safely. But unfortunately, that's what's happened. There are now, I think, over 160 providers of AI services, AI scribes, and an awful lot of them have just done just that. They used AI to create the system. They haven't paid so much attention to the finer details about security and about data handling and thinking about the sort of importance of medical care. And that's why we have this plethora of companies offering it. And I think, the really important thing for all doctors is rather than get excited by the technology is actually just to make sure they actually ask the questions, how is the data being held, who's processing it, what steps have been made to make sure there aren't any mistakes, et cetera, et cetera. Yeah.
The so that's also fascinating. It all sounds so intriguing. It sounds like
Yeah.
there's a lot that we could be doing now as GPs with the technology, the stage one, I think, as you called, or something, that the
The
type
class
one,
one, yeah.
class one,
Medical device.
and there's a lot to be looking forward to as well. I mean, my personal thoughts on if we start pointing AI engines at vast practice systems, it's just there's going to be the workload of general practice. It's just going to be, I careful what you ask for. It would be overwhelming, and it would, and of course, it could impact those who need to, the urgent care. But so as there's many of our members work in 30 different practices a year. We're working in often struggling practices who have been trying hard to recruit or retain GPs. Some practices are amazing and are right up there in adopting early technology, but there are practices there who just struggle to just fit everything into a day. So new technologies to them, they can be quite phased about. So if our members watching or listening to this episode are keen to start using AI in a practice that doesn't currently use it, what's the best way to approach the practice to see if we can, and if we can bring our own technology with us that plugs into
Yeah.
the practice system? How does that all work?
And of course, with Lexicom, they can, because they have a Lexicom account, then they can actually access that from any web browser or any computer and install it without any admin rights. But obviously, you can only do that with the permission of the owner of the
Yes.
computer, which is usually the praxis or the ICB. Um, what I would say is, obviously, there are complexities about installing any AI system. We can install Lexicon with the speech recognition in the workflow without any AI, so there's no restriction for that pre-installed whatsoever. And we can install it without the AI being activated. And that obviously is what a lot of people do to get around the fact of having the benefit of the speech recognition, speak to text, and the coding automatically in system on an EMIS with using that technology. Um, but also we have what's called an onboarding pack, which is available to everyone. So if your listeners were to email sales@lexicom.co.uk and ask for an onboarding pack, we can send them a zip file which will have all the documentation that goes through very, very clearly what needs to be done by the practice or the user to make sure that it is, got the legal tick boxes to use AI. I'm pleased to say that Lexicom exceeds all the standards that are set by the government for use. So we know that we are able to provide the service. We just need to make sure that the practice is aware of their responsibilities and making sure it's done responsibly. And obviously we will help them in any way we can. But once you've got that and the conversation, we can then sort of get it up and running literally within a minute or two. There's web browser versions of the software which have a sort of a user interface where you can do the ambient AI and speech recognition. Or like I say, you can just click on a link and download the software and install it with the user's permission without admin rights, because it's held within the sort of the local file system of the user, not on the actual computer's sort of core sort of system.
Fantastic. Well, I think, Andrew, is there anything else you want to say about sort of AI technology in general practice before we go at all?
I really just think, the only thing I'd say is try it. If you can't try it, ask us for a demonstration. We do weekly seminars where you can just sign up and let's see it in action and see what it can do. And then just, ask yourself, is this going to be of use to me? Because quite frankly, I can't think of any clinician that if had someone sitting there writing down everything they said and typing for them like they used to 30 years ago wouldn't like it. And this is basically what we're giving every doctor, who wants it. It is quite remarkable. You obviously have to check it and make sure you're happy that it's saying what you would want to say, but it does a remarkable job at it. And all I say is that we wouldn't survive without the feedback from our customers, our users. We are the only privately owned company left in the market. Everyone else can raise money from venture capitalists, which means they've got mouths to feed outside their own company. They've got to generate profits. So it means we can keep our prices, again, much more reasonably paying, which is very important at a time when sort of finances are strapped and pressures are high. All I say is, sign up for a look at it, get a demonstration, see what it can do. If you want to try it, you can try it for free. We won't, charge anything for people to have a go. And please just keep feeding back what you like and don't like, because, we've got some very exciting advances coming out in the next couple of months. And then our roadmap is sort of, full for the next 18 months and I think, the more we do, the more it will include the whole practice, not just the clinicians.
Yes.
The diabetic checks, the asthma checks, but also, the reception staff, we're helping them with appointments and bookings, helping the practice manager staff with meeting notes. So, the version just coming out will have multi-person meetings. So you can stick a microphone on your practice meeting desk and it will take the notes for you and give action points and minutes at the end of the meeting. And of course, with the new mobile app, which will be coming out around Christmas time, we can use a Bluetooth lapel mic and do the ambient AI out in home visits wherever we go. So it will be a truly mobile sort of solution as well. So yeah,
Fantastic.
exciting times. Dip your toe in the water, sign up for one of our webinars where you can ask any questions and see what it can do. Have a free trial. And if we can help, please drop me a line. We're more than happy to help.
That's brilliant. And I should have said at the beginning, I'll make sure I put it in the show notes as well, that I came to Lexacom because I bumped into you guys at one of the Pulse Live conferences.
That's right.
Had a great conversation, and then I took up the offer of your very generous free trial, and I've really enjoyed using it in my practice, and it's just yes. So thank you very much for that. So I thought I would sort of share that with our audience as well. Andrew, thank you so much. We'll put your contact details again of Lexacom in with this. And thank you for coming along. It's been great having you. Take care.
It's been a pleasure. Thanks so much for your time, Richard. Thank you.
Bye.